Welcome to the deep dive.
Great to be diving in.
Today, we're plunging into something really fascinating and truly global: medical tourism.
Right. People crossing borders for, well, all sorts of things, major medical procedures, aesthetic treatments.
Exactly. And our sources for this deep dive, we're working from excerpts of a transcript, actually getting perspectives from medical practitioners right in the thick of it.
Yeah, boots on the ground stuff.
So our mission is basically to unpack the crucial things to consider, maybe some surprising facts, and definitely the potential pitfalls.
Whether you're a provider seeing these patients, or maybe you, the listener, are thinking about going somewhere else for treatment.
We want you to be well-informed. It's a huge part of our connected world now, isn't it?
It really is. It's not going away.
Okay, let's unpack this then.
So I think the first thing that jumps out from the sources is just how much of a two-way street this whole thing is.
Mm-hmm. Not just people leaving the U.S., for example.
Yeah. No, not at all. It's just as significant, maybe even more so in some areas. The number of people coming to places like the U.S. or the U.K. or wherever for treatments.
It's properly woven into our global society.
Absolutely. It's just part of the landscape now.
And that kind of globalization, it immediately brings up some pretty complex challenges, doesn't it?
Oh, definitely. Especially around communication and culture.
The sources really hammered that point home, how critical it is to get that interaction right with international patients.
Totally. And it's way beyond just, translating words. Cultural differences in how people communicate, they're massive.
How so?
Well, like what might come across as really blunt and maybe even a bit aggressive in, say, American culture could just be totally normal, expected directness somewhere else.
Ah, okay. So you need to recognize that.
You really do. As a provider or just, interacting generally, you have to see that difference and approach it with respect, not judgment.
That makes sense. It's about making a conscious effort, isn't it? To understand and, respect different ways.
Yeah, and the source had that little anecdote, remember, about visiting Sweden.
Oh, the hi thing?
Exactly. Just noticing locals say hi,
Right.
entering a shop and deciding to do the same. It's simple, but it signals you're, trying to engage respectfully.
Yeah, I like that example.
And then if you take that cultural lens even further, aesthetics, beauty standards, they vary hugely around the world.
Okay, like how?
Well, the source gave this really striking example. In parts of Asia, apparently they sometimes inject filler right under the lower lashes.
Okay, why?
To create this little sort of puffiness. They call it a jelly roll. And it's seen as youthful, cute even.
Wow. Whereas here in the US or UK, people might actively try to get rid of puffiness under the eyes.
Exactly. It's almost the complete opposite aesthetic goal for the exact same anatomical area.
That's wild. Are there other examples like that?
Yeah, the sources mention others too. Different preferences for nose shapes, forehead contouring, even what's seen as ideal for male facial features can differ quite a bit.
So the takeaway for a provider is,
you have to be aware of these differences and, crucially, avoid pushing your own cultural beauty norms onto the patient. Don't judge procedures that are common or, really desired back in their home country.
right. So, okay, recognizing the cultural stuff is vital. But let's talk practical communication, the language barrier itself. How do you genuinely bridge that gap? Especially for really important things, like informed consent forms.
Yeah, which are often just in English in the U.S., for example.
Exactly.
Well, this is where, honestly, technology has kind of removed the excuses, hasn't it?
Like so.
The sources talked about AI translation devices becoming game changers. Those little earpieces or handheld things.
Real-time translation.
Pretty much, yeah,
It's
instantaneous. But it doesn't even have to be that fancy.
What do you mean?
Think about Google Translate on your phone. Everyone has a smartphone, right?
Mm-hmm.
The speech-to-speech function works pretty well now. You say your bit, it translates, speaks it out. Patient replies, same deal.
So readily available.
Totally. There's really no good reason anymore why a language barrier should stop clear communication about procedures, risks, benefits, and especially understanding those consent forms. Using these tools isn't optional. It's essential.
That level of clear understanding feels like the absolute foundation, particularly when we get into safety, patient safety when they're traveling.
Yeah, and this is where the sources lay down some really important protocols or strong recommendations, Eddie.
Such as?
A key one is, for certain procedures, fillers were the main example given patients really should plan to stay locally for, say, at least 24 to 48 hours afterwards, minimum.
Okay, why that specific time frame?
Because some of the more serious, Thankfully rare, but serious adverse events like a vascular occlusion where a filler blocks a blood vessel, they often don't show up right away.
Ah, it's not immediate.
Not always, no. It can take hours, sometimes even a day or two to become apparent.
And the source mentioned that specific case, didn't it? The patient from Ohio.
Yeah, wanted fillers, but absolutely had to fly back the same night. And the provider, quite rightly, had to refuse the treatment.
Because safety comes first.
It has to. Look, there's always pressure, right? Someone's flown in, they're only here for a short time, you want to help them.
But you can't compromise.
You just can't. That's why those pre-procedure consult calls, maybe video calls for out-of-towners, are so valuable. Manage expectations early, talk about recovery time, why they need to stick around locally.
Okay, but let's play devil's advocate. What if someone genuinely can't stay that long? Is there any responsible way?
Then you need a plan B, a really clear, robust plan.
Which involves?
Making absolutely sure they know how to contact you, like immediately, 24/7 if something seems wrong. And ideally, having a resource, maybe a trusted colleague you know in their home city or wherever they're going, who could potentially see them, assess them, manage a complication.
That requires some networking?
It does. Now, maybe some procedures, like certain lasers perhaps, might have a slightly lower risk profile for immediate travel compared to injectables. But the principle holds. What's the plan if something goes wrong when they're thousands of miles away?
Makes sense. And quickly, that common question the sources brought up, flying after Botox or fillers, any actual physical danger from the cabin pressure?
Physiologically, no.
Yeah.
Plane cabins are pressurized, okay, maybe to the equivalent of being 8,000 feet up a mountain, but lots of people live at those altitudes. It's not like deep-sea diving pressure changes causing the bends.
So the worry isn't the pressure itself.
No, the real worry with flying straight after is simply the distance. If a delayed complication pops up mid-flight or when they land far away, they're physically separated from you, the provider who did the treatment. That's the issue.
Got it. Okay, that clears that up. Let's shift gears a bit now into the legal side of things. Regulatory stuff, ethics, when dealing with medical tourism patients.
Yeah, this is where it gets, well, pretty complex. And you really need to be careful.
From the provider's angle, what's key?
Absolute transparency. Legal disclosure. It sounds basic, but you must tell the patient exactly what product you are using.
Why is that so critical? Beyond the obvious, I mean.
Because product names can be totally different in different countries, even for basically the same substance. So just saying filler isn't enough. Brand name, type, everything. Clarity is vital.
And patients have rights to their info, right?
Absolutely.
Bruh.
Legally, they have a right to their medical charts, their records. And for international patients, it's not just good practice. It's essential to give them a detailed copy of their treatment record.
What should that include?
The specific products used, definitely the lot numbers, where exactly you injected or treated. Think about it. They need that reference for themselves, and it's crucial if they see another provider later, anywhere in the world.
Okay. Now, talking about products, the sources raise some pretty big concerns about stuff being used elsewhere.
Yes. This is a huge potential problem area. There's a very real risk, unfortunately, of fake products, counterfeit stuff, or just substandard materials being used in some places.
Like that example given.
Yeah, the sources mentioned practitioners hearing about patients who'd gone to, say, Mexico, got fillers, and came back with really lumpy, bumpy results because it wasn't the expected hyaluronic acid at all, something else entirely.
And sometimes it's not fake, but just different standards.
Exactly. Some countries still commonly use permanent fillers, things like medical-grade silicone or other substances that might have historically been called Aquamed or similar names. These are rarely, if ever, used now in places like the US or UK, and sometimes they're actually illegal.
How do you even know if a patient has that?
Well, if someone comes in with old filler that looks or feels strange, using ultrasound can be really helpful. They can often identify if it's silicone or some other permanent unknown substance.
That risk also works the other way, doesn't it? For practitioners thinking of getting cheaper products from abroad.
Oh, massively. The sources were really clear on this. Buyer beware is putting it mildly. If you're a practitioner sourcing products outside your country's official legal regulated channels,
Why?
you just have zero guarantee of what you're actually getting. Is it sterile? Is it even the right substance? Is it expired? As one source put it, one bad batch, one dodgy box could literally end your career. Not to mention the patient safety aspect, which is paramount.
So, treating an international patient, the ethical standard is identical to treating a local one.
100%, unwaveringly. The moment you accept that patient, you accept responsibility for their care and well-being.
Even though follow-up is harder.
Yes, Follow-up is definitely more challenging with transient patients, no doubt.
Yeah.
But your ethical obligation to provide proper care, to have a plan for complications, that doesn't change just because they're flying out tomorrow.
It's about professional integrity.
Totally. It's patient first, always. It
Ah.
can't just be about the money or the convenience. You take on the responsibility when you take on the patient.
Could building that global network help manage that responsibility? You mentioned colleagues.
Yeah, the sources suggested that's a really good idea where possible. If you meet trusted colleagues at international conferences, build those connections. Why? Because if one of your traveling patients does have an issue back home or somewhere else.
You might have someone reliable there you could potentially refer them to.
Exactly. For a local assessment, maybe initial management, it could be incredibly helpful in a difficult situation.
Okay, that covers a lot from the provider side. But let's flip it. What if you, the listener, are the one thinking about traveling for a procedure? What did the sources stress about your homework, your due diligence?
This is so important for anyone considering it. The sources really flagged the issue of smoke and mirrors, especially online and on social media.
How so?
They gave that specific example of a before and after photo for some male surgery, supposedly from Turkey, that was trending. Turned out it was completely fake.
Not even the same person.
Nope, different guys in the pictures. So you really have to be skeptical.
So, step one, healthy dose of skepticism. What else?
As a potential patient, you absolutely need to vet providers thoroughly. Don't be shy about asking detailed questions.
Like what?
Ask about their specific training. Ask about their experience with the exact procedure you want. How often do they actually do it? Do they publish research? Do they teach?
And be wary of extreme claims online.
Definitely. Whether it's ridiculously over-the-top positive claims or even super harsh criticisms you see on forums or social media, ask yourself, who is this person making the claim? What are their qualifications? What's their experience level?
It sounds like cutting through the noise is the main challenge.
It really is, and the sources made a great point. Good work is good work. Often, really excellent results, especially in aesthetics, look natural. They don't scream, I had work done.
While the bad results are more obvious.
Exactly. Bad outcomes are much more visible, and unfortunately, they can sometimes unfairly tarnish the reputation of entire fields or destinations, even when there are genuinely skilled people working there.
Speaking of destinations, some countries do get known for certain things, right?
They do. The sources mention the common ones. Turkey for hair transplants, maybe Brazil or Colombia for body contouring, Thailand for gender confirmation surgeries, South Korea for certain aesthetics.
But that reputation isn't a guarantee.
Absolutely not. That's a crucial warning. Just because a country is famous for X procedure doesn't mean every single doctor doing X in that country is good or safe or ethical.
So you can't just pick a well-known destination and assume you're fine.
No way. You must do your homework on the specific individual provider, the clinic, everything. Referrals from people you trust are still incredibly valuable, whether the provider's down the street or across the world.
Ultimately, what's the most critical factor when choosing someone, especially abroad?
The sources really circled back to this. It's their plan, their documented plan for managing complications, and their explicit willingness to take responsibility if something does go wrong.
How will they support you if things don't go perfectly?
Precisely. Are they committed to being there for you, figuring it out, helping you through it if, stuff hits the fan? That commitment, that plan, that's probably the single most important thing to look for.
Wow. Okay, this deep dive really shows just how many layers there are to medical tourism. It's complex.
Definitely. You've got the cultural nuances, the communication challenges, the safety protocols, the legal stuff, the ethics, and then the whole vetting process.
From both sides, the provider and the patient.
Yeah, it touches on so many aspects of healthcare in a globalized world. Understanding it, based on what these practitioners shared, gives you a much better handle on navigating it.
So here's maybe a final thought for you, the listener, to chew on. In this interconnected world, thinking about medical tourism isn't just about travel. It's also about realizing how these diverse practices, different standards, these patient journeys from all over, how they might actually be influencing healthcare everywhere, even potentially in your own community.
What might you encounter or need to understand because of someone else's medical journey that started somewhere else entirely?
Something to mull over for sure.
Definitely food for thought.
Well, thank you for joining us for this deep dive. To stay connected for future explorations, make sure you follow us online. We'll catch you next time.